Well, welcome to a very special Fox 411 and Kiss Country neighborhood news. We have our sponsors here, Jay, for,
Yeah,
for that
CG
stuff that
Public Health.
CG Public Health. That's right. They're located at Plaza West Shopping Center. You loving your location out there
It's
next to Hobby
great.
Lobby? Yeah,
It's great. Yeah.
I bet it is. It's great.
Too many
And
restaurants out here, though.
yeah. Well, that's a great plaza. It really is. You can go online all the time, cghealth.com. Lots of information there for you to check out. And the reason why we're having Jeni on here from CG Public Health today is because, well, we're getting into that winter season, and everybody's concerned about, viruses and everything else. And Lord knows we just, obviously have had a big one for the last couple of years. But we're here to talk about the big three. Do you want to tell Jeni, the audience out there, what the big three is?
Yes. So right now we're seeing a drastic increase in illnesses throughout the community. RSV, which is a respiratory illness that we're seeing a lot in the babies. The older kids can get it too. Adults can get it. It's more like a cold for them, but the babies just don't tolerate RSV well at all.
Why is that, you think? Why a thing for babies? RSV, have we ever seen this before?
Oh yeah, RSV is
Okay.
around usually this time of year, but we don't see it as much as what we're seeing right now. The babies just don't do well with the illness. I don't know if it's maybe due to that their respiratory system is fairly new, but for the older kids, I mean, they still can get pretty sick. And for us adults, we can too. And it can be, not
Mhm.
good for elderly as well with the RSV.
But what I'm asking is why now? I mean, is there a reason why we just are going overboard here with this RSV in kids?
I don't know. I don't
That's
know
the
why.
question of the day, huh? Okay.
Yeah, I mean, uh, I don't know if it has anything to do with, our immune status with, the mitigation that we had before, or,
Mhm.
sometimes, like influenza, one year we'll have a horrible year, and the next year, it doesn't,
Different all the
go as
time, yeah.
bad. And
Yeah.
it just happens to be that this year we have the RSV, the influenza, and then again, COVID coming back. So we have that triple threat.
All right. So there are vaccines for all three, or what?
So there are vaccines for flu, and
Mhm.
there are vaccines for COVID. There is some medication that they do provide to like preemies and that for the RSV, but not a typical um, vaccination.
Hmm. So you make appointments and get all three of them at once. Or can you take all of them at once, the shots, or you got to come in individual different times?
Oh, yep, you can come get your flu shot and your COVID shot. We have shots for everybody from 6 months on up. Appointment. So visit us online at cghealth.com. Just click on you want to schedule an appointment, and yeah, we can get you in, get them both done on the same day.
Yeah.
Do you really get a lot of people coming up to you guys to get those shots, or do
Oh,
they go, or do they go to their doctor more, or do they go to their pharmacies and stuff? But you do get your share.
yeah, we stay pretty busy. I think we're booked out maybe a week. We do shots on Mondays, Wednesdays, and Fridays, 10 to 4 are our times. Usually by now, this time of year, we've really seen most of the people that we're going to see for flu. But, with the holidays and that just around the corner, it does take a couple of weeks for those vaccines to take effect. So we really want people to get in sooner than later.
Hmm.
You got holidays coming up. Is that
Oh,
gonna? You think that's gonna increase everybody being inside?
Yep,
Yeah.
yep. And it's everybody's going inside and everybody's getting together with each other. So it's really important that we try to stay home when we're sick. We don't want to take influenza to Christmas.
Right.
So, changing plans, rescheduling, whatever you have to do, just because, like I said, right now we're seeing a surge in all three. The hospitals, the clinics, they're very full. So
Now, what do they mean by very full?
very full, meaning that they are having to, send people out to other facilities. If people need to be hospitalized, they may have to be transferred out to somewhere, Minneapolis, Des Moines, somewhere like that, where they're going to be away from home. Or, if a parent has a child that has to be transferred out. And, if you think about the pediatric units in the hospitals, they're not that big. And so they can't take, as many patients.
I heard there were. Oh, go ahead, Jay.
I think if you come in and get the flu, we'll put you in the flu room. So everybody's got flu because you can't transmit it to each other, right?
Yeah. Well, depending if they have influenza A or influenza B.
Well, you can test for that, though, right?
Yeah, they'll test.
Yeah,
for it.
So you got room A and you got room B.
Yeah. They could have a COVID floor, an influenza floor, and an RSV floor.
Yeah,
these flu strains that come in.
Mm-hmm.
I remember having the flu. It was probably the worst flu I ever had in my life. I don't, really, get sick very often, but I have had the flu, and I had it back 5 years ago. I remember. In fact, to be honest with you, I thought the flu was worse than COVID was for me in 17 than it was in 2020. And I never want to have what I had in 17. Well, I don't want to be sick anyway, any other time. But do these flu strains, you said the A and the B, is that all there is? Or is this a different flu strain that's coming through than it was last year, a year ago, a year before that, whatever?
No, I think right now they're really seeing the influenza A. So the H1N1, it's covered in the flu shot this year. So getting that.
So, okay. So, we've heard about COVID vaccines and boosters and all that stuff. How often do you need a booster for like the flu?
Every year. Everybody should have a flu shot, for that flu season.
Okay. Well, that's good to know because I don't know if a lot of people knew that. I've had one fall. Anyway, the thing of it is when we were kids, we didn't have a say what vaccines we could get or anything like that. It's just that was the, we got what did we get when we were babies? You get the measles, you get the mumps, you get the polio. I don't know how many different ones there are, but this is the ones that we get as a baby, right? Yeah, and I know they're talking about maybe adding some more. I don't know. That's going to be a heated discussion, I think, for a long time. But what else am I forgetting there and stuff? But then then it's all up to us on kind of volunteer vaccines after that, isn't it?
Yeah, you can get a COVID booster now. So there's a booster. It's a bivalent, meaning it's got the two different strains. And so that's something that a lot of people, I think, we've been boosting people and boosting them. And so I think it just kind of got lost. So there is the bivalent that is been new since September. So if you haven't had a COVID vaccine since September, you need that booster dose. As long as it's been 2 months since you've had your last dose, you can have that.
Do you have to start over if you go too long in your booster?
Nope.
Just keep
going.
All right.
Okay. All right. And how about some numbers? I think a lot of people want some proof in the pudding here. How are we doing here locally, percentage-wise, however you guys have on your graphs or whatever, on the flu, on COVID, on the respiratory stuff? We talked about the kids. I understand that. How about the adults then?
So what we do as far as influenza, they don't give us like specific numbers, because what happens is when you go to the clinic and you're not feeling well and they test you for flu, they test you with a rapid test. And so that rapid test comes back positive. That test doesn't go any further as far as
if it's A or B.
And so they'll do that rapid test on you, but they don't keep track of like numbers, I guess, if you'd want to say, when it comes to influenza. Okay. So the only way that the state does keep track of those numbers is when you go into the hospital and you test positive for influenza, That test is then sent down to the state hygienic lab for a confirmatory test so that we know that the activity is in our area. So what we do is we do disease surveillance with the schools and the child care centers. So each week we reach out to them and they provide us information on what illnesses they're seeing within the community or within their schools and daycares. And so we use that information as well as each school, if they reach a 10% absenteeism due to illness, they have to report that to the state. And then the state reaches out and says, hey, public health, you have a school in your area that is reporting a high rate of illness. And so then we have to reach out to the school and see, is there anything that we need to do to help, provide them with information on cleaning, information on illnesses. We send messages out to the parents and to the providers to let them know what's going on too. So that's really what we work off of, is that school and childcare information, and then what is reported to us, I guess.
Yeah.
So when you do the number, I'm just going back to the numbers. So if the hospitals are the only one that report to the state, but you don't have to, then so there could be more cases than what's reported.
Oh, definitely.
Or less.
But you know what, though? I mean, to add to that, though, Jenny, I mean, one of the things that I really liked when I went to the public health site all the time during COVID, when COVID was, I mean, we were all kind of wondering what the heck this is all about. I really enjoyed, well, I don't want to say enjoyed, but I liked the graph that I had on every county. They were telling us how many people, were coming into the hospital, how many were hospital stays, how many people were tested, and all that kind of stuff. I know this is a question is probably more so for the, maybe for the World Health Organization or CDC or something like that. But how come we don't do that for everything? Or do we do that? We just don't let it all out. And it was more pertaining to just COVID, which I think should be just with everything then. I mean, if you can see that, let's say Floyd County had double the amount of flu episodes more than Sarasota County. You kind of get what I'm saying here?
Yeah. Oh, yeah, definitely.
Do you have graphs like that up all the time, or we should?
There is through the Iowa Department of Public Health, they do influenza surveillance.
Okay.
So they do provide some of that information on their website, and then they'll reach out to us and give us like that report. With COVID, it was really nice, but all of the COVID cases, remember, everybody was going through like a testing site or a clinic or the hospital. So all of those tests were counted. Well, then all of a sudden, nobody's doing the testing really anymore. And it's all going to, people are getting tests sent to their house to take. So none of those positives were ever getting reported because people are taking rapid tests at home. So you're not going to get a good idea, of what's going on unless you look at the tests that are done in the clinics. And a lot of people are going in for their illnesses or taking their kids in right now. And so they are doing COVID testing there then too. But these are not, back in the beginning when it was all reportable and we had to follow up with everybody, it's not like that anymore. They don't report them to us. We don't follow up on any of the cases anymore. So things have definitely changed. They'll still count like deaths, for influenza and for COVID. So that information, they will not put out at a county level. It goes out as like a state level. And that's just because they don't, for confidentiality.
Okay. Now, when it comes to the tests, I haven't had a test for a long time for anything. So is it still the go all the way up to through the nose, up to the brain?
Some of them. I mean, that's probably what you're going to get when you go into a clinic. Yeah. The other ones are pretty, just up maybe an inch, So.
Why do you got to go so deep?
Yeah.
I just want to make sure that they're getting a good sample.
I can get a good sample just right around the ring here.
I
Yeah.
swear I was getting a biopsy. I swear.
Yeah.
That's what it felt like. So they still do those kind of tests. Even the home tests are like that too?
Most of the home tests that I've seen, they're like just go up an inch. You still
Oh,
got to kind of get up, but you don't have to go all the way up.
okay. And
Yeah.
is CG Health condoning those home tests yet, or do they they want you to, or you as a CG Health want people to come out and get tested by you guys or pharmacies or doctors or whatever?
Yep, we don't do any of the testing, and I
Okay.
don't know that the pharmacies are doing any more of the testing.
Okay.
But of course, if people can get a rapid test for at home or a at home kit, if somebody isn't feeling well, we want them to test so that they're staying home the appropriate amount
Mhm.
of time.
And
Because it's still, go ahead.
what is the time now? Because we started off this thing, what, 10, 12 days, and then it went
Mhm.
down to like 5, and now it's like
14 down to 10, I think.
or 14
Yeah, it
down
was
to 10.
14 for if you were exposed to somebody even and
Yeah.
didn't even have it yourself. But now it's still the 10-day. They
If
can do
if you
5 days, but then from day 6 through day 10, they need to wear a mask when they're around other people.
Hmm.
So it's still the 10 days.
Oh, it is. Okay.
Mhm.
I just wish people would just, including myself, you don't feel good, stay home. I mean, what's
Yep.
the big deal? I mean,
Right.
seriously. I mean, isn't that the old adage that we were told even 20, 30, 40 years ago? Listen, if you don't feel good, take a sick day, for God's sakes. Just
Yep.
go home.
And that's one thing too that we really want people to keep in mind that if you're not feeling good, if you're running a fever, you need to be fever free for 24 hours before returning. So, and
Mhm.
that's without the use of a fever reducer. So, no Tylenol or ibuprofen. But, we'll have, someone who maybe has a fever today at 2 o'clock, they're still running a fever, but tomorrow morning they're not. And they're, starting to feel a little bit better. We still need them to stay home that additional day, for that 24 hours. And the same thing applies, we're hearing of the gastrointestinal stuff now too. So if you're having diarrhea or vomiting, you need to be free of that for 24 hours, a full 24 hours before you return to your regular activity. And it's really important too that, people understand that, like with influenza, you can spread influenza the day before you even know you're sick yourself. And even for a few days after you're feeling better. So it's really, really important that we use other strategies, like washing your hands frequently and, you know, distancing yourself from other people, not, you know, um, gathering, with a whole bunch of people at this time when we know that we have so much activity in our community, to keep ourselves and other people that are at higher risk from getting sick.
I got a general question for you.
Mhm.
Is it the default nowadays because of COVID? Is it the default that if you're homesick, you should test?
Yes.
And why is that?
Like I said, just so people know what it is that they have. Do they have COVID? Do they need to stay home the additional time? With COVID being, so new, we don't know, are we going to have it, where they're going to come out with another variant, is it going to mutate again? And we're going to end up with something like the Delta that was bad. We don't know with COVID. So
Is there a test kit for the flu, influenza, whether it's A
I,
or B
I
at
don't
home?
think you can buy them over the counter. Those I believe are all going to be done at your doctor's office.
So you could be negative for COVID, but positive for flu.
Yeah.
And sometimes, I mean, everybody kind of knows their body a little bit. I mean, they know, oh my God. I mean, like, for instance, I know when I got a sore throat,
Yeah.
but you don't know whether it's strep or not until you go get a test, obviously.
Hmm.
Same thing
And
goes for this one.
that's the thing. They all mimic each other as far as symptoms go. I mean, and not everybody has all the symptoms, and so it's hard to tell. Do you have influenza? Do you have COVID?
Mhm.
One thing that's um, helpful to know is when you have a bacterial infection, like your strep throat or whatever, you're going to have usually like one symptom where it's going to be like a sore throat. And then when you get into your viruses, you're going to have multiple symptoms usually. So you're going to have like the body aches, the fever, maybe a sore throat. You know, some people with influenza, the little kids can get vomiting and diarrhea from it, you know. So, like I said, they all look the same a lot of the time. So it is helpful to have testing done so that you know.
Have you had COVID yet?
Have I?
Yeah.
Yeah, my husband brought it home to me. I
Uh,
got by for 2 years without having COVID. And then my husband calls me, he's a police officer. He calls me and says on a Monday, so I get up this morning and I felt kind of sinusy, you know, I just thought it was allergies. And I'm like, okay. And he said, then I came to work and there's 3 guys out with COVID. I'm like, oh, go get tested. Sure enough, that was Monday. I had it by Thursday.
huh.
Yeah, I didn't get very sick. I mean, I had
Yeah.
Omicron, so I mean, I didn't get very sick with that. But my son now had it. He's 12, but he had it back in 2021 in October. He didn't get real sick. He had like a headache one day and then a cough for like a day. And then he ended up with influenza in January, and that took him out. And it was bad.
Wow.
Mm.
So
What's the most anybody has had for vaccines? Just curious on COVID. You know, they've had
number.
many of them out. Yeah, because is this I could be, I don't know, third booster? Yeah.
So okay, so they had
Yeah.
the initial Moderna was 2 doses,
Yeah.
and then you could have a booster dose.
Yeah.
And then
That's
that
3.
booster dose, they changed it and they said people with like immune compromised people can have 3 doses as their primary, and then they could have another dose for a booster. So yeah, I mean, there's people that they're on their 5th dose.
Wow.
Yeah.
All
Mm.
right. Well, we appreciate you coming on board here, Jenny. We appreciate CG Health getting all the info out, and of course, your wonderful sponsorship that we have here with our Fox 411 and Kiss Country Neighborhood News as well. Um, the big 3, you got to be aware of it. And this is a season that lasts probably, well, all winter, I would imagine, all the way till March. And how are we and I guess simple question, Sarasota County? We doing okay otherwise other than the is it RSV? Is that what you said?
Yep.
The
RSV,
RSV
influenza,
is that
COVID, and then strep throat is.
and RSV
Um,
probably leads the pack right now.
I would say probably influenza is going to be what's spiking right now. The RSV, I think, is starting to kind of settle down a little bit. But yeah, you never know what's going to happen the next day.
I
And
think
like
I
I
did
said,
hear Jay, did you hear that? I think I heard the rumor that there was a lot of flu going on in the schools. And so
Yeah. A lot of kids are out right now.
yeah.
yeah. And they like I said before, they have to report if they're having a 10% or greater absenteeism. And, you know, normally we would get maybe a school here, a school there. And last week, for the week before, I mean, it was terrible. I mean, a lot of them were reporting, and they were reporting a lot greater than just the 10%. So,
Mm.
All right.
Yeah, teachers are out and
mhm.
students out, and
They asked Jay and I if we would teach, so that's
Yeah.
getting pretty bad.
suddenly everybody got okay.
Yeah.
They were feeling much better.
Well, I pull in all the resources that you can get, you know.
You
I
know,
mean,
Jenny, it's just so weird. I mean, because you're looking at, well, I'm almost 60. You know, Jay is 50 this year. You know, and I mean, I grew up on a farm. I mean, he grew up in a rural area as
I was
well.
on a farm too.
And we were, it's like today what just happened. And this was fun snow. I mean, of course, I had fun by going out and snow blowing this morning. But, I remember being a kid going out and playing in the snow and going out. And I remember them saying back then, this is good for you. Get out and enjoy some of that winter. Good for the immune system. You know what I mean?
And it's good to just get out there. And, I think maybe if more kids were playing outside rather than hanging out inside together, you got that ventilation.
I know what it is. It's social media and phones and video games. They need to get out and make more snowmen. Do you want to build a snowman, Jay? Remember that song?
Oh yeah.
Okay.
I tell you what, I moved enough snow this morning. I'm like tired of it.
Yeah. I tell you what, it was.
My husband went out and cleaned the driveway this morning. I was surprised. I mean, he was out there right away, and the snowblower, I don't know, something happened. And he was like, but I was glad. Like it stopped working or something. He was like, but I was glad because I was over it. I'm like, yeah. Well, you still got the front to do. So
yeah. All right, Jenny, thank you so much for joining us here today. Anything more you'd like to tell the public out there?
I think just, be mindful and stay home when you're sick. If you have to reschedule those holiday get-togethers, we don't want to share all that over, this Christmas time. And we a lot of times do see numbers will go up after Thanksgiving and Christmas time, and that's because people are getting together. And it's been hard the last few years because people haven't been able to get together and they really want to, but
do you think we could still hang the mistletoe?
Yeah.
Yeah, go for it.
Yeah.
Especially if your husband goes out and snow blows for you.
Right.
Exactly. And if we do come in and visit you, I haven't seen your facility down there, and I know you guys have been super busy.
You should come in. I like to give people tours of it.
I know at the hospital, masks are optional right now. Are they optional also at CG Health when you walk in?
So if you go on to the CDC's website, there's a way on there you can type in your county and it will bring up what the transmission rate is in the county at that time. So we have our safety officer that monitors that daily. So if we reach like a moderate to high transmission level of COVID within our community, then we all have to put masks back on. So then we do ask the public to wear masks.
Okay. All right. Jeni Stiles joining us here for our Fox 411 and Kiss Country Neighborhood News and cghealth.com. That's the easiest way to go find out info. Or if you want to go see them, see their great facility, I would think it's a lot better now than it was a couple of years ago to walk in. I'd like to tour during COVID, yes. And, but they're right next to Hobby Lobby out at Plaza West Shopping Center. So.
And we're pretty nice here too, so.
Yeah, super people. Yeah, we work with Jeremy all the time down there, so that's great.
Great guy.
Okay. All right. Thank you very much.
All right, thanks for having me.
Have a good winter and Merry Christmas. Happy New Year. You bet.
Yes.
Okay. Bye-bye.